Provincial Auditor Tara Clement says the SHA needs to find more workers and keep the ones it has. She says the SHA will have an estimated 2,200 position shortages over the next 5 years in hard-to-recruit areas. Specifically, more than 800 continuing care assistants, more than 500 registered nurses, and nearly 200 medical laboratory technicians. She says the current government strategy of hiring new workers from here and abroad is positive, but it's not enough.
I think the focus can't just be about getting more new people into Saskatchewan. It's about retaining the current workforce that the authority has as well.
Clement says the SHA just started doing employee surveys. She calls the results not good. She says 66% of workers said they're burnt out. She's calling on the government and SHA to identify and communicate which areas of the province have staffing shortfalls.
So at the end of the day, they didn't have a good analysis to tell me which facilities in this province have the most almost significant gaps.
The report found that more than 700 full-time positions are needed in Prince Albert, Meadow Lake, and La Ronge over the next 5 years. Clement says the SHA should do exit interviews to find out why people are leaving and why they may not want to work in rural areas.
It's a little bit worrisome that it took them this long to have an overall formal health human resource plan. It is something that I would have envisioned you had sooner once you've basically centralized and become one overall provincial health authority.
The health minister just returned from a recruitment trip in the Philippines. He says that trip was successful, as are some of the other initiatives the government has undertaken this year.
Recruitment to the Philippines went extremely well. 129 offers made to individuals, and these are the individuals that are extremely excited about the opportunity to come to Saskatchewan. Their families are excited for them. But not only that, we're also growing from within Saskatchewan with our advanced education placements. We've also got recruitment from across Canada, the doctors we've recruited.
Merriman says rural and northern Saskatchewan are the areas most in need of healthcare staff. He says the government's committed to filling positions in those areas, so there are no further service disruptions and no closures. Adam Hunter, CBC News, Regina.